hawk eyes. Okay, so hawk eyes. Well, why hawk eyes? Because I want you to use your hawk eyes to see what the pathology is. This is a 69-year-old male with dilated cardiomyopathy and also a pancreas tumor, which was newly diagnosed. And the patient had heart failure, severe heart failure, as a matter of fact, dyspnea grade 3 to 4. And he came into this echo, to the echo lab, and this is the echo I'm going to show you now. Okay, and I'll just show you a few images, and then I want you to see if you see anything abnormal. Now, this is left ventricular function, obviously significantly reduced. This is very poor left ventricular function. There's also dysynchrony. You can see a pacemaker lead in here. The patient also had an ICD implanted and a CRT system. Very poor left ventricular function. Very large left atrium. So I would say end-stage left ventricular dysfunction. Yvonne, you see pleural effusion, and you are correct. This here is pleural effusion right here. Can you see this? This is part of the lung, and this is fluid here. Very good, actually, because I think, you know, these are the things that you should notice on a normal echo. You know, pleural effusion is something that I always tell my students, you have to find a pleural effusion with echo. The echo is the ideal method to look at this. So very good, Yvonne. Right here is the pleural effusion. Look at regional wall motion abnormality. Look at the atria. Okay. Again, this is a two-chamber view. This is kind of a view where we also have the right atrium in the field of view. This is the left atrium. Very poor left ventricular function. Okay, this again, left ventricle, left atrium. Okay, look at the spontaneous contrast. This is really neat. I'll just go close. You see how the swirls, you can see the swirls in left ventricle. This is basically a sign that left ventricular function is very, very, very poor. Okay, now it's your turn to answer a question. Okay, you ready? Let me see if I can answer the question. One second. Here we are, questions. 1 second. Yeah, I'll have it in a second. Okay. Okay, good. So the question now is, what do you give the patient? An antibiotic, anticoagulation, a new valve, chemotherapy, or you just send him off to someone else who should take care of him and just put him on a plane. Okay. Some of you who have been with me with these webcasts before know that what I like to do very often is I show you images and I kind of distract you from what is really supposed to be noticed, and then I ask you, did you see it? So this is what I did here. Okay. Antibiotic, 3%, 10% chemotherapy. Okay, I'll give you maybe 5 more seconds. So if you want to answer, yeah. We're not going to check what you answered. So you can be assured that you have the right answer. Okay. Okay, let's close this. Okay, so most of you think it was, at least most of you would use anticoagulation therapy, 15% chemotherapy, 5% antibiotics. I mean, 3% will send the patient off. Okay, so let me just go back to this image now and show you what I saw, and I would be curious to know if you saw what I saw. Well, of course, you know, if you see this spontaneous contrast, this is usually something that should prompt you to use anticoagulation. Obviously, the patient also has atrial fibrillation, so aside from the fact that there's spontaneous contrast, you would use anticoagulation. But the thing I would like to point your attention on is this here. I don't know if you noticed. There's a mass right here. What is this? Well, this is the left atrium, and here we have the left atrial appendage. This is a beautiful view which shows you the left atrial appendage. Usually you get it somewhere between a 4 and a 2 chamber view, and in this case the left atrial appendage is so large simply because the patient has very high left atrial pressure. So this large atrial appendage is very nicely to be seen, and what we see in here is, Yvonne, you've got the right answer. It's a thrombus. Okay, so this is a thrombus, and now we could see it in more than one views. Let me go back again. You see it right here as well, and you see it here too. So we saw it on several different views, but to really confirm if it was a thrombus or not, you would obviously either perform a transesophageal study, or as we did, we used a CT scan. And this is the CT scan of this patient. Just for your information, here is the left atrium. This is the pulmonic vein. Okay, one vein here. This is the left and this is the right. Here is the aorta, the right ventricle, right atrium, which is also cut on this plane. And this here is the left atrial appendage, and right here you see this thrombus. Okay, so we can diagnose the thrombus also with the help of CT.